Doctor, for coming.
You're more than welcome. My privilege.
Today, I want to talk about a topic that probably nobody's ever heard of, or if they have heard of it, they don't know much about it. And that's called natural killer cells. It sounds scary, is it?
It's very effective.
All right, let's get to it.
Part of our innate ability to fight infections and fight cancers has to do with our body's ability to kill those cells, whether they're cancer cells or infectious cells. So our body has developed a whole system, an infrastructure of natural killer cells. Those natural killer cells are part of the white blood cell group in our bodies. So you've got red cells and white cells and platelets all in the bloodstream all the time. Those white cells have many groups in them. One of the groups are those that go after and kill the what we call foreign cells, the cells that are not innate in our bodies, that don't belong there. So cancer cells are by definition a type of cell that have grown wild. They just replicate and replicate and replicate. All of a sudden, there's way too many. And they, in most instances, don't even belong there. So a natural killer cell identifies them, and then it goes in and it eliminates part of the membrane, the wall around the cell, and opens the content in the cancer cell, spills it into the bloodstream, and it dies. So what we can do is help patients fight and sometimes very successfully live through a cancer by using our own immune system, i.e. the innate natural killer cells, to kill the cancers. You may want to know the mechanism of that. Would you like to know how that happens?
I do.
Okay, what we do is we take your blood and we spin it down and we find out what cells are fighting the cancers in your body. After we find those, we put them in a culture and grow them. So it's in essence taking a platoon and making it into an army. And so you have all these fighting cells, and those fighting cells often can recognize the cancer, and then they open this membrane and kill the cell. Now, you're going to say, well, what keeps that in check? It only attacks and kills those that don't belong. So it doesn't go after all the cells. It only goes after those cells in your body that are foreign, are not innate.
Okay, so recently the whole world has gone through COVID-19, which is a virus,
Yes.
which was foreign to our body. So the people who lived through it before we got vaccinated, did they have natural killer cells that were stronger than those that unfortunately died?
Probably. There's many types of immunity. There's immunity in your cells, there's immunity in your blood. How that immunity works depends upon what they're fighting. In a sense, viruses like SARS and all the different types of COVID stimulate our body to create the defenders. You don't belong there. You're foreign. We're going to fight you. Now, then our bodies create these defenders. That's what the vaccine was. The vaccine was a commercially available defender that was stimulated by the vaccine for your body to make more defenders against the COVID.
To recognize it.
To recognize it and to kill it.
Yeah.
So there often is vaccines for many different types of things. Think of all the wonders of medicine. Think of polio, think of tetanus, think of all the diseases that have been inhibited, in fact, close to eliminated by vaccines. Vaccines are part and parcel of our defense system to kill unwanted infections and cancers. Anything that doesn't belong there.
Do you have any instinct or medical knowledge or just, why is it that we couldn't figure out who was going to die from COVID and who was going to live through it? That was always the thing, because I was a COVID doctor for 2 years, and I had 20 COVID patients a day. And for instance, I'll give you an example of mine. I had 2 people come in, boyfriend and girlfriend, and they were both in the room together, and I examined them, and I thought the man was worse. I sent him for a chest x-ray. The girl, she had diabetes, listened to her lungs, was okay. 2 days later, she died. When I called on Monday to say, how are you guys doing? The guy told me she died.
That's sad.
And yet in the exam room, my instinct was the guy who lived was the worst case. Did you have anything like that?
Well, I think that the deception there was that the patient appeared on the outside a lot healthier in the case of the man than what was going on inside that body. What we have in all of us are what is called comorbidities, other illnesses, other susceptibilities to illness. And so he must have been stronger than she was, because she's the one that died.
Right.
So all of a sudden her diabetes made her a susceptible woman. Here, she probably had other factors. I don't know if she'd taken care of herself or not. What was her vitamin D doing? All these variables that you don't get on a one-time encounter in an office. It is true that we can optimize your best defense against anything like COVID is to optimize your own health. Optimize the body's innate ability to kill foreign cells.
Okay, and what are the top 5 things that someone can do to optimize their health?
The top 5 would start with sleep. You need adequate sleep. That's when your body replenishes. That's when your body cleans the brain. That's when your body makes neurotransmitters. So sleep is essential to health. The second thing is stress. Get rid of that. Increase your sleep, but decrease your stress. Stress is one of the worst, if not the worst, factor in a healthy body.
And how would someone get rid of the stress in their life when the stress is at your house and you're living with your stress? How do you fix that?
Okay, so we'll get back to the other 5 factors in the response, but the stress is, you address stress 4 ways. First and foremost, most people use exercise to diminish their stress. And it's very good because it increases your circulation, and nothing heals without good circulation. The second thing that happens to get stress is meditation, prayer, other things that take your mind off what is bothering you. The third thing is to have hobbies, to have things in which you keep busy, whether it's carving or singing or sewing or whatever, cooking. It doesn't really matter. It is an alternative to what you're worrying about. And the last thing, and probably the most powerful thing for stress, is to help other people and get your mind off all your woes and transfer some of that, spiritually and otherwise, to others. So that's really the 4 major ways to deal with stress. Going back to your initial question was, what do you do to enhance your immune system? I started with sleep. I said, increase your sleep and decrease your stress. There's 3 other very important things, and the next one was fitness. Exercise, not just walk. You've got to move your arms when you walk, but it's better to move them so that the function of the body is established for everything that moves. So that exercise is crucial. Then you have 2 other areas that most of us prioritize and should be for health, and one is fluids. If you're not hydrated, you're susceptible to all kinds of illnesses from minor variations in heat and other things. So hydration is easy to do. It's cheap. All you have to do is look at your output. If you're voiding, that's a fancy word for peeing, as soon as you go to the bathroom, you can determine if you're hydrated or not. Is it clear? Now you're going to say, oh, I take a whole bunch of vitamins and mine is yellow. Okay, that's fine, but it's probably not necessary. We'll get into that a little later. But most of the time, your body needs a lot more water than we drink. The last thing is food. So you're in a situation where nutrition is becoming more important, not less, because we're having more and more pesticides and other things that impair the quality of what we eat. And so your body's spending some time just cleaning it up. So when it gets to that liver, your liver's the detox center. It comes down the esophagus, hits your tummy, and tummy has to get it so that it could get absorbed and digested. And then it goes through the liver and finally out the door through the kidneys. But all those steps are crucial to cleaning up what some would call is a very tainted diet.
Now, getting back to the natural killer cells, which I sort of took you on
We went down a rabbit hole.
I went down a rabbit hole. So getting back to them, you told us a little bit about it. So the natural killer cells, of course I know white blood cells are our first line of defense, and there are many different parts of it. Continue on with the natural killer cells. What do you like about it? What do you think we do to inhibit our natural killer cells? And we're fighting against ourselves. And I'm ambushing you here, but we can go into autoimmune diseases.
Well, let's start with one at a time.
All right.
When you get 3 or 4 questions coming at one time,
Sorry.
I forget them. So the way NKCs, natural killer cells, work, we've already addressed.
Right.
And what happens is we draw your blood, we identify those natural killer cells that are targeting the cancer in you or the infection in you. And it is not commercially available. You can't go and buy mine and have it help you. These are unique to you. So the autologous aspect of this, the uniqueness, is one of the strengths of an office. So you want the killer cells that are going to kill the ones you have. You don't care about Helen's, you don't care about Happy Henderson's, you care about yours. So one of the most important things is to realize it's individualized. Once you get there, then it's a question of volume. How many are you going to have? How many do you need to grow? Traditional oncology in this country is nothing short of miraculous. Look at where we have been in just my 40-some years in medicine. What is the survival rate of all these cancers? And a lot of things are better. Now, some are not much better, but let's look at the bright side. There's been a good job done. Now we're in a situation where we need better. And so one of the core issues of that is unique to America. There's other countries doing a lot of good work outside of traditional cancer therapies because they're innovative and they don't have near the regulations we have. We have to be pretty open to taking and evaluating to make sure it's safe. Safety's first. Safety is what we build our therapies upon. But if it's your stuff, it's pretty safe. You're not rejecting your stuff. So you're making it, we promulgate it, we increase it, and it's about the only way I know of that you can kill cancers that have mutated. In other words, many types of cancer go into your body and adapt so they can grow and win the battle for food and nutrition and grow. So those often mutate. That means the DNA in that cancer changes so that it can win the war for nutrition and survival. So what has to happen to beat those guys is you take your innate ability and the natural killer cells and sick them after those cancer cells. That wins.
But it's not only cancer. It's what about sinusitis? We had a patient the other day. She's been suffering with chronic sinusitis for, I think she said 5 years. She hasn't slept in 5 years because she's so swollen. You took her in to the ultrasound. you found a pus pocket. You were able to clear that up in one visit. She'd been to multiple doctors.
Okay, so that's not natural killer cells.
Oh.
And what happened there is we flushed it. So you found the infection.
Yeah.
The infection was a pocket. It was walled off in the sinus. It was masked because it was hidden in a polyp. And so it was a little dicey to even find, but it was found. And then what we did is we put it on the proper treatment, and that included flushing it and getting the gunk out of that sinus. So part of it was also, and we'll get into this, I guess, at a later date, but part of the intravenous therapies we were able to give her in the office. So in that case, sinuses are holes. Most people don't know, how many sinuses do you even have? And if you didn't say 8, you were wrong, because there are 4 on each side, right? You've got the frontal and the maxillary, the sphenoid and the ethmoids, and they're on both sides. You got 8 sinuses, and they're cavities, they're holes. So if there's bugs in there, then let's say you're sedentary and you don't exercise, you don't sweat, you don't flush your sinuses, then it's a pretty good place for bugs to grow.
So natural killer cells have nothing to do with that?
Well, the natural killer cells, if that's an infection, they're going to go in there and kill that infection.
Yeah.
Yes.
Okay.
But there's not the requirement in that case for us to grow them.
Oh, I see. You're talking about natural killer cells that you're multiplying and then giving back to the patient their own natural killer cells in a larger army.
That's right. Absolutely.
Okay.
In fact, that's a good way to look at it. You're moving it from a platoon to an army.
Okay.
And in most cases, I think in each case I've ever experienced, it's far more rapid and it has a greater percentage of success. In NKC therapies, immunotherapies in our office anyway, have a success rate of over 80%. And the reason for that, I think, has to do with the fact that, remember, they're individual.
Right. So would people with autoimmune disease benefit from this therapy?
Well, would people with autoimmune disease benefit from NKC cells?
Yeah.
Is that the question?
Yeah.
And the answer is yes, if what they're fighting is not considered innate. In other words, if the body views it as foreign,
Right.
then it would benefit. The number of autoimmune disorders that we're aware of today, I think, is very close to 1,000. They're 800 to 1,000. And so they're all over the place. The most common, those that are known the most in medicine, are things like lupus, systemic lupus erythematosus, lupus, rheumatoid arthritis. I mean, when you get into real diabetes is autoimmune, you can get into some pretty wild common autoimmune disorders. But there's hundreds. I think there's over 1,000 autoimmune disorders. So it's a good area to get into to help patients. The key to this whole thing is helping patients.
Right.
So they'll come in and they may have a susceptibility, some wild-ass infection because of their autoimmune disorder. Something may be out of whack with their immune system. And that makes them more susceptible to some innate problems.
How do you tell if someone's immune system, what kind of test, can you do a blood test and say to look at the blood test and say, your immune system is lousy?
Yes. So the question is, do blood tests help identify autoimmune disorders?
Right.
And the answer is absolutely. In fact, the lab sciences in our country are doing a better job of identifying greater and greater strains of different types of disorders. And they're able to take an anti-nuclear antibody and define which type it is by not only its pattern, is it speckled, is it not, its frequency, and it can do it as well from its response to different bacteria. Now, I will say that when you get into autoimmune disorders, we're in a bit of a dilemma because there is a susceptibility of those patients to severe infections fast. So that opens the door to what they call opportunistic infections.
Oh.
And those are fungal, those are Lyme, those are in rickettsial. There's all kinds of opportunistic infections. So if your defenders are down, you're a susceptible woman to a bad infection that otherwise wouldn't affect a normal person.
Okay, so let's talk about people who aren't sick, like me. I have no illnesses. I'm healthy. I mean, I think I am.
Okay.
So I come in and I'm a patient, and you do a complete physical on me. You put me through your workup, and all of a sudden you look and how do you tell that a person who has no pre-existing autoimmune or that you could say, Helen, your immune system is showing me that you're a little weak here?
Yeah, that's a good question. In our office, what we do is, besides the history, which I sort of beat you guys up on, learning that the history is probably the most important part. So you need to listen to the patient, is what that means. Take the time, listen to their story, from birth to the present. Then what happens is you require an exam. And that we use an advanced clinical exam that is automated. We use digital examinations. You've got a stethoscope sitting there that we use and other things. So it's digital, like mine. So that you can hear and you can see that any malformation or anything that's not, quote, normal in that exam.
Let's talk about this. I looked up, and our normal stethoscopes that doctors have been using, of course, you said probably back to Hippocrates, but this actual one was invented in 1816, and we have been using this for
Ever.
200 years almost. Now we have this. So if you go into a doctor's office that's cutting edge, like Dr. Henderson's office, he gave me this. And I went, am I straightening my hair with this, doctor? What is this? I've never seen anything. You want to?
Well, and in between, this is a Littman 3200. And so this is a standard brand, and this is about $400 or $500, and it's digital. So you can pick up any heart sound, any breath sound, any carotid, and you can port that to an image, so it's a phonocardiogram. That is even better, because if you look at it, it does it in real time right into the screen. So that ports the digital footprint of what's going on in your ticker, and that really helps patients. So we've moved there, and as we moved into this clinical exam. So we start at the top, and we can get into that another time, but the brain stuff, and then moved all the way down to the toes. The question you are still on the table is, how do you identify these autoimmune patients? Those autoimmune patients are far more susceptible to pressure points in their body than other people. So that a good massage for a lupus patient might hurt them. And that'll give you a pretty good heads up. Hey, we better look underneath that skin. If you have uncanny ability, or let's say a more prevalent number of illnesses, if you're a susceptible person to frequent infections, you better check the immune system. And in that are some of the vitamins, the fat solubles, A, D, E, and K, could all be out of balance or in some imbalance. Those should be checked too. And then you have, through some of the more specialized labs in America, you have phenomenal ability to identify not only if they have Lyme or lupus, but what type and how long and what severity. So it's pretty fancy, it's beautiful.
Now, one of the things you have, I would call it artificial intelligence type of exams, which I went through. You made me stand on the, or you make the patient stand on this thing, and we put our arms out, and that machine could tell how much water I have in my body, how much lean muscle mass I have in my body, and how much fat I have in my body. That was amazing to me.
Yeah, it measures what you said: weight, water, and strength. And
just from standing.
From all limbs.
Yeah. Just
pretty
was-
cool. They have others that use a photograph, in other words, photography, to take you through the entire range of motion. So you can see the range of motion of every joint and know if yours is within the normal range of a healthy person. So let's say you were in an accident and you hurt your shoulder like you were talking about. If that shoulder didn't move correctly because it was frozen or you screwed up your rotator cuff or something, we'd know immediately, and then we could help heal it. The body's going to help some, we're going to help some, and then we'll track it and we'll make sure it's getting better and better.
Very good. Well, ladies and gentlemen, if you have heard Doctor and anything that he's talked about sounds like your other doctors, you've gone to multiple doctors. Sometimes I have a patient who comes in and says, I've seen 10 physicians. Really, I have had that, where they have gone from doctor to doctor with no help, still have the same problem. They don't want to be on drugs. They don't want to be drug addicts. They don't want to have to keep going. You know, a lot of doctors make you go back to their office once a month to get a prescription, or you don't get that prescription, then you got to make an appointment, then you've got to get off work, and then you've got to do this, and you got to do that. So, doctor, you've got about a minute and a half. Talk to your audience, talk to your new patients, and tell them your philosophy about that.
Well, our philosophy is, our goal is to optimize your care. And we do that with objective evidence, not subjective, not something I make up, something we can prove to you and show you you are getting better, and how much better are you. So it has to be objective, and it has to be outcomes. So we track how you responded. Inherent in that is looking at the other parts of you. In other words, what's your support system? What's going on at home? You may be someone that is caring for another. The majority of care in America is determined by women, and those women care to make those decisions 80% of the time, and many of them are sandwiches. They're taking care of their children, and they're taking care of their parents and their in-laws, and they're in between. This is not a bologna sandwich, this is a lady sandwich, and she's got the responsibility for making the healthcare decisions above and below the patient.
Thank you, Dr. Henderson. As you heard him call himself Happy Henderson, he's a happy man, he's a happy doctor. And like I said, if any of this rings a bell for you, please call the number and make an appointment. He is taking new patients. And thank you for joining me on Doctor to Doctor.